Have you ever considered what happens to your body when your blood sugar levels remain elevated? High blood sugar isn't just a statistic. It sets off a chain reaction that can silently damage multiple organs. In the next 3 minutes, we'll uncover how this process unfolds, the organs affected, and practical steps you can take to protect your health. Insulin resistance. It all begins with insulin resistance. Regular consumption of high sugar or high carb foods can overwhelm your body, leading to elevated blood sugar levels. When your cells become resistant to insulin, glucose builds up in your bloodstream. This persistent state triggers endothelial dysfunction, damaging the linings of your blood vessels. As blood vessels become compromised, inflammation occurs, making it easier for plaque to form. This sets the stage for a variety of health complications, from cardiovascular issues to organ damage. The longer you maintain high blood sugar, the greater the risk for your organs. Blood vessels and heart health. Compromised blood vessels directly affect your heart health. With increased pressure on the heart, it has to work harder to pump blood effectively, raising the risk of heart disease and hypertension. The damaged blood vessels can lead to atherosclerosis, a buildup of plaque that narrows arteries and restricts blood flow. This can result in serious conditions like heart attacks or strokes. To protect your heart, focus on a heart-healthy diet rich in whole grains, fruits, and vegetables. Regular exercise, such as brisk walking or cycling, can significantly improve your cardiovascular health by enhancing circulation and reducing blood pressure. The impact on kidneys. Elevated glucose levels damage the nephrons, the tiny filters responsible for cleaning your blood. This condition, known as diabetic nephropathy, can progress to kidney failure, requiring dialysis or a transplant. As your kidneys struggle to function, waste builds up in your bloodstream, leading to further health complications. To safeguard your kidneys, it's essential to stay hydrated and manage your blood pressure effectively. Regular monitoring of kidney function through blood tests can help catch any early signs of trouble. Dietary choices like reducing salt intake and consuming lean proteins can also support kidney health. Eyes and vision. Over time, elevated glucose levels can lead to diabetic retinopathy, a condition where the blood vessels in the retina become damaged. This can cause vision loss and, in severe cases, blindness. High blood sugar can also increase the risk of cataracts and glaucoma. To safeguard your eyesight, schedule regular eye exams to catch any early changes. Keeping your blood sugar level stable through a balanced diet and regular exercise is crucial in preventing complications. Remember, the earlier you detect issues, the better your chances of preserving your vision. Brain health. Research suggests a connection between chronic hyperglycemia and cognitive decline, increasing the risk of conditions like Alzheimer's disease and vascular dementia. High glucose levels can lead to inflammation and oxidative stress in the brain, impairing memory and decision-making abilities. To keep your mind sharp, engage in activities that challenge your brain, such as puzzles or learning new skills. Maintaining a healthy diet rich in antioxidants, omega-3 fatty acids, and regular physical activity can support brain health and enhance cognitive function. Nerve damage. Nerve health is crucial, as high blood sugar can lead to neuropathy, characterized by tingling, pain, or loss of sensation in extremities. This condition occurs when high glucose levels damage the peripheral nerves, leading to discomfort and even mobility issues. Poorly controlled blood sugar can also affect the autonomic nerves, which control bodily functions like digestion and heart rate. To minimize nerve damage, it's essential to control your blood sugar levels through a balanced diet and regular exercise. Incorporating B vitamins, particularly B12, into your diet can help maintain nerve health and alleviate some symptoms associated with neuropathy. Digestive system. The digestive system can also suffer from high blood sugar. Elevated glucose levels can lead to gastroparesis, a condition where the stomach takes too long to empty its contents. Symptoms like bloating, nausea, and unpredictable blood sugar levels can arise, making meal planning challenging. To manage this condition, focus on smaller, more frequent meals that are high in fiber and low in simple sugars. Foods like vegetables, whole grains, lean proteins, and staying hydrated can promote better digestion. Gums and teeth. Oral health is another casualty of elevated blood sugar. Diabetes can lead to gum disease, characterized by inflammation, swelling, and infection of the gums. High blood sugar weakens your immune response, making it easier for bacteria to thrive, which can lead to tooth loss and complications. To maintain good oral hygiene, brush and floss regularly, and schedule routine dental checkups. Keeping your blood sugar level stable is also essential in preventing gum disease. Incorporating foods rich in vitamin C and calcium can support your gum health, reinforcing your body's natural defenses against oral infections. Skin health. High blood sugar can also affect your skin, leading to conditions like acanthosis nigricans, which causes dark patches to appear, particularly in body folds. Poor circulation due to damaged blood vessels can hinder healing, making infections more likely. Dry skin and fungal infections are also common among individuals with high blood sugar. To keep your skin healthy, maintain proper hydration and use moisturizers to prevent dryness. Regularly monitor your blood sugar levels and maintain a balanced diet rich in vitamins A and E, which promote skin health. The liver. Lastly, let's talk about the liver. High blood sugar can contribute to non-alcoholic fatty liver disease, NAFLD, where excess fat builds up in the liver. This condition can lead to inflammation, fibrosis, and potentially cirrhosis if not addressed. The liver plays a crucial role in regulating blood sugar levels, and its health is vital for overall metabolic function. To protect your liver, maintain a healthy weight through diet and exercise, and limit alcohol consumption. Foods rich in antioxidants, such as berries and leafy greens, can also support liver function and combat oxidative stress. As we've seen, high blood sugar doesn't just affect one organ. It has far-reaching impacts across your body. But there's good news. Many of these effects are preventable. By adopting a balanced diet, engaging in regular exercise, and closely monitoring your blood sugar levels, you can significantly reduce the risk of complications. You should also watch this video on other impacts of high blood sugar you shouldn't ignore. And please subscribe to this channel if you find this video helpful. Thank you for watching.